So today I would like to be speaking to us on sexual arousal disorder. Now, as the name connotes, there is no arousal. It's simply a condition whereby the individual fails to respond to sexual stimulus. It is different from what I explained earlier last week, sexual desire disorder. The difference is that in sexual desire disorder, there is no desire, there is no interest in everything about sex. But in arousal disorder, there is desire, there is interest. But just that the organs responsible for sexual activity fail to respond to stimulus when they are being stimulated. Now, aside from the fact that they fail to respond to stimulus or stimulation, the other things that you may notice with sexual arousal disorder is that, one, the previous psychological cues, that's things like thinking of your previous sex encounter or seeing erotic things that used to turn you on and keep you in the mood, these things no longer stimulate you. Then another thing is that even when you try to initiate the sex itself, you find out that you gain little or no pleasure from the sex. And sometimes it may also be what's it called, in combination with sexual desire disorder, whereby in this condition there is no desire as well, you are having arousal disorder at the same time. So these are some of the symptoms that you may experience for someone that is having sexual arousal disorder. Now, what are the causes? Now, for this video purposes, I would like to classify the causes into about 4. We have anatomical causes, we have hormonal causes, we have psychological causes, and have what I would group as others. Now, all things being equal, without any of the known causes, one of the commonest causes of this kind of sexual arousal disorder is what we call insufficient stimulation. Now, if there is no issue at all with the person and one notices that he's having this kind of condition, it means that there is decreased foreplay. So what we recommend is that you tell your partner to try to increase the foreplay as much as he can before the activity engages itself. Find out when these areas are adequately stimulated, the person may be in the mood and get in the mood. But aside from that, we have anatomical causes. Now, when it comes to arousal, there are a lot of factors that play a role. Normally, the vagina and the penis are flaccid, they are just collapsed. But during arousal, some chemical impulses, a lot of things take place that leads to increase in blood supply to the genitals. Now, when the blood supply to the genital increases, for the penis it gets erect, and for the vagina it tends to become a little bit hard and there is maximum lubrication. But if somebody has an injury with the anatomy, the person notices that he or she may not be able to accomplish some of these processes. So some things that can lead to that: someone that has spinal cord injury, somebody that has occlusion of the